Hi Sheena, it's Liz Palmer and I'm just doing my head to toe assessment. Hi everyone, I'm Liz Palmer and I'm a nursing student from Durham College and I'm here going to be your nurse today to do a head to toe assessment. Is that okay with you?
Yep.
Wonderful. So I would do an environmental check. I'd make sure that there was oxygen and suctioning and that it was operating, that it was connected correctly. Nasal prongs are available, that the bed rails are up, the brakes are working, the call bell's within reach, and the bed is at the lowest position. So the first thing I would note about Rowan is that she is awake and upright and she appears very calm and relaxed and she isn't exhibiting any severe signs of distress or pain. So Rowan, what brings you here today?
I have the splitting headache for the past couple of days.
Okay, and can you describe the pain for me?
It starts up in my forehead and then radiates to my temple.
Okay, is there anything that makes it worse?
Sudden movements, bright lights,
Anything that makes it better?
and a dark room.
Okay, so on a scale of 0 to 10, with 0 being no headache pain at all and 10 being the worst you've ever experienced, where would you rate yourself?
Today I'm about a 3 or a 4. Yesterday and the day before that I was about an 8.
Okay, and what time does it come on?
As soon as I wake up until I go to bed.
Okay, and do you know what might be causing it? Okay, so we're just gonna do a head to toe assessment and see if we can collect some data and find out what's causing your headaches, okay? And I'll share this information with the doctor and then you guys can discuss where to go from there. So I would do the vital signs. Rowan's temperature was 37.2, normal is 36 to 38. Her respirations were 14, the normal range is 12 to 20. Her blood pressure was 120 over 80, the normal is 90 over 50 to 140 over 90 would be the range. Her heart rate was 72, so normal range is 60 to 100, and her oxygen saturation was 98%, and we look for something between 95% and 100. So Rowan, all your vitals are in the normal range. Okay, so now what I'm going to ask you to do is I am going to ask you to show me your armband. Can you tell me your first and last name?
Rowan Palmer.
And what's your birth date?
May 7, 1998.
Okay, where are we?
We're at the hospital.
And what's the date today?
August 2nd, 2020.
Okay, so Rowan is awake and alert and oriented to time, place, and person. And then what I'm going to do is I'm going to ask you to look at the wall over my shoulder. And what I'm noticing, Rowan, is that your pupils are equal in size. They're round and they're reactive to light. Then I want you to just look at the tip of my pen. Perfect. And that your eyes are accommodating. And that just means that when you're following the pen in, your eyes converge into the middle. So that's wonderful. Now I'm going to look at your upper extremities, and I'm noticing that Rowan's skin is consistent with her ethnicity, that she has no signs of cyanosis, pallor, or erythema. Do you mind if and there's no masses and no pulsation. Her musculature looks symmetrical on both sides. I'm just gonna, temperature is even all the way down. Can you squeeze my fingers? Strength is equal and strong. Capillary refill is good. It's refilling, blanching, and returning to regular color within 3 seconds. Her radial pulse, equal and strong. Her brachial pulse, equal and strong. Good. Now I'm just going to look at your anterior chest area. I'm noticing that your trachea is midline. I'm noticing that you don't have any trachs or anything like that. There's no masses, there's no pulsations, there's no wounds. The skin is, there's no sign of cyanosis, erythema, or pallor. And so, can I palpate?
Yep.
Okay. So I'm just looking at her. And again, there's no masses and no tenderness. Can I just lift up the shirt there?
Yep.
And I can. And there's no tenderness on the lateral sides. Okay, I'm just going to listen to your breathing, Rowan. Okay, so take a deep breath. I just pull up your shirt. Big breath. Another big breath. Big breath. 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 Wonderful, Ron. So her breath sounds are clear from the apex to the base, and there's no adventitious sounds. There's no trachea, but if there was, I'd be checking the site and the drainage and make sure that the dressing was dry and intact. Okay, so now Rowan, I'm going to check out your pericardium, and again, there's no pulsations, there's no signs of cyanosis or pallor or erythema, so I'm just going to listen to your heart now. Okay, so first what I'm going to do is second intercostal space. The aortic pulse S2 is greater than S1, and it's just right to the sternal border. Looking for the pulmonic pulse. Second intercostal space, left of the sternal border. S2 is louder than S1. Then go to Erb's point. Just third intercostal space, just left of the sternal border. S2 is equal to S1. Then I go to the tricuspid, which is in the sternal border, fourth and fifth intercostal space. S1 is louder than S2. Can I just lift your shirt? And then I'm going to go to the fifth intercostal space, mid-clavicular line. And this is the apical pulse. And I would stay here for 1 minute to collect data. I would compare it to the radial pulse. They're both equal and strong. Good. And then I would also check for bruits, so I would turn it over, or any murmurs I should say. I would turn it over and do the bell, use the bell to, again, auscultate the same spots to catch and locate any murmurs. I could also turn her on the left side to check for murmurs using the bell. Okay, can I have you just slide down and lay flat, please? I want to just check your abdomen. So when I look at Rowan's abdomen, there are no masses, there are no stomas, there are no striae, and her profile is flat, and there are no pulsations. So the first thing I would do with Rowan is I would auscultate first for bowel sounds. There should be between 5 and 30 sounds per minute, and I would start in the lower right quadrant. Okay. If I didn't hear any sounds, I'd have to listen for 5 minutes per quadrant. I would also auscultate her aortic artery, her femoral arteries, and her iliac arteries to see if there were any bruits. And if there was a stoma, I would check to make sure that the skin was intact, and I would check the drainage also, and that there was no sign of infection. Rowan, when are you having any troubles going to the washroom at all?
No.
When was your last bowel movement?
Today.
Any problems with that?
No.
Okay, I would also check her Foley catheter, check the size, and I would check the drainage if she had a Foley catheter. Okay, wonderful. Okay, now I need to palpate, so I would do a light palpation. So I'm only going to go down 1 centimeter. Tell me if there's any tenderness. If Rowan was experiencing tenderness in her abdomen, I would palpate that region last, so as not to cause any undue pain. And then I'm going to go deeper. Okay, I'm checking for masses, and I could go again deeper, and if there's no tenderness and there's no masses. If there was a mass that was pulsating, I would not palpate it because it could cause further issues. Now I'm just going to look at your extremities, your lower extremities. And again, when I look at her lower extremities, there is no cyanosis, no pallor. It's consistent with her upper extremities. There's no edema evident. Her musculature, it's symmetrical bilaterally. Her muscles seem symmetrical also. I'm just going to palpate for your temperature. Good temperature. I would check her popliteal pulses. Equal and strong. Equal and strong. equal and strong. I'm going to check your capillary refill. Again, it's good capillary refill. It's the toes blanch and come back. Can you just push your toes? Excellent. Good strength. Good strength. Strong strength bilaterally. There's no there's no dressings or anything that need to be looked at and checked. Okay, can you just sit up for me? And now I'm looking at Rowan's posterior back, and I'm looking for her spine is straight. There's no masses. Skin is intact and consistent with her ethnicity. There's no signs of pallor erythema or cyanosis. So I'm going to just palpate Rowan for any tenderness. Okay, there's no tenderness. And then I will listen to her breathing. Deep breath, Rowan. Deep breath. Deep breath. I'm careful to listen to her breathing so it's not in her scapula. Breath. 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 Okay, good. So once again, Rowan's air intake and exhalation is clear from the apex to the base bilaterally. And then Rowan, I'm just going to check one more thing if you can stand up. And I'm just going to check. Okay. Take a deep breath for me. One more. My hands rise at the same rate, so her air intake is equal bilaterally. So Rowan, it seems that all of my findings so far are normal, so that's good news. I will share what I've learned with the doctor, and he'll be in shortly to discuss your headache pain and where you go next. Do you have any questions for me?
No.
Okay, so you've got your call bell here. If you need anything, please just give me a call.